chilling, but a lonely civilian is as common. And some think we're beefing when we're actually bonding. Or it's common to the senior citizen looking at some pictures when her child was a kid. It ain't nothing like remembering. Or common that shackles on our minds and souls. But how long you think these shackles gonna hold?
As long as I can breathe, I suddenly swear to make a difference.
Okay, thank you so very much for tuning in to yet another interview with an incredible talent from Trinity Health Services or Trinity Health Systems. Folks, there have been a lot of individuals, and for the first time in my life, I've actually experienced this, not personally, but I'm married to someone who actually went through this process. There's a period in which several periods actually that women go through their age and as they transition from one era to another. And then today we're going to talk about that era where women go through a period dealing with a thing we call, and I shouldn't call it a thing, but a condition that we call menopause, folks. And we are truly blessed because we have a wonderful, wonderful guest here today. Folks, she is a DO, and her name is Dr. Katherine Kirby. She's with Trinity Health Medical Group Obstetrics and Gynecology out of Muskegon. And Dr. Kirby is a board-certified OBGYN. And to me, I feel that that's a very important attribute to have as an OBGYN, particularly for us fellas who love our wives, our daughters, our mothers, and our sisters. That certification tells you that this is somebody that knows exactly what they're doing and that their colleagues recognize their expertise. So I want to thank Dr. Kirby so very much for being our guest. How are you, Dr. Kirby?
I'm so good. Thank you for the introduction. It's so nice to meet you and to be here today.
Well, I appreciate that, ma'am. It's really good to meet you as well. As I had noted in the opening, we're going to be talking about menopause today. And it's going to be something where some frequently asked questions, that people present to you as they come to your office. I'm going to open that conversation up with that. And the most basic one, even though we all assume we know what this is, we never really defined it. We just know it's a situation. Tell me, what is menopause?
Well, that is a great first question. And what I tell my patients is that it's a great question to ask, really, no matter what age you are. It's something that I hope becomes more of a topic that people know about. We spend so much as women and female patients, we spend so much time talking about leading up to menstrual cycles, going through the cycles of our lives. You can spend a whole third of your lifetime having menstrual cycles. And then we spend limited time actually thinking about the part that comes after menstrual cycles. And that's where menopause really begins, but it begins and continues. So menopause in itself is a very normal and natural event that happens later in a woman's kind of lifetime, usually around age 51 for the average American. But it can start anywhere between, 45 all the way up to 55, so that kind of range of time. And what's happening is usually when the ovaries are starting to decrease in their hormonal production. So our ovaries are what make our estrogens. And when those ovaries start to decrease in their role and their job, which our ovaries are to really make eggs. And when they get past that time and they're not longer needing that function, the estrogen decreases. And that's what creates the changes that you see when we get to menopause later in life.
There's a technical word that I'd like to present to you that I'm sure you know the definition, but I've always made the comment pre-menopausal. The medical term, I think, is perimenopause.
Yes, that's correct.
Talk to me about what is that?
So perimenopause is a very specific time period that in medicine helps me understand where a patient is in their menstrual cycles, helps me really translate for them things that might be happening, symptoms that the patient might be experiencing. It's that couple years, sometimes about 4 or 5 years before actual true menopause definition takes over. And the difference between is when your periods have completely stopped for 1 whole year on their own, and we've ruled out any other reasons or cause for that stop. We can say, hey, you are now in menopause, and we're going to transition over to thinking about your body and how your symptoms are developing in a menopause-like state. But the transition before that actually kind of fluctuates up and down until we get get there. I tell patients all the time, it is not a, hey, things are starting and here they end. It is an up and down, kind of more like an escalator going down, kind of up and down rodeo. And those fluctuation and those intervals have lots of different symptoms that can come with it.
Yeah, a lot of women, again, they think they know menopause, but some things, changes in their body, certain changes in their body are unexpected. What changes happen to women during menopause?
Sure, that's a great question. And it's something that I think has not gotten a whole lot of attention of in years past. We think of, I think of my mom, my grandma, my aunts, it was this kind of hush hush kind of mentality of, oh, they're going through the change, or something's happening to them. And couldn't quite understand it, especially when I was younger. And I'm sure for generations, even older than me, it was something that, it wasn't always celebrated. It wasn't always something that was seen as, a passage of time of, hey, you're in this new part of life and your body is doing different things. But the most common symptom people will associate with menopause, one is stopping periods. Their periods have stopped, but also hot flashes. But however, there's actually lots of symptoms that happen with menopause. That stop of estrogen from your ovaries really affects our bodies from head to toe. It can affect things like sleep, our moods, how we're feeling from day to day, all the way down to just feeling more vaginal dryness, pain with intercourse, and things like how our weight is redistributed in our bodies.
Hollywood is really taking this thing to the extreme as it relates to women going through menopause. I just want to, if we can, does menopause cause moodiness and depression?
That's a great question. We appreciate our, Hollywood colleagues, but sometimes it can be extrapolated a little bit. But it's a good question because we think, things that have come up in the past of, oh, they're crazy, or, oh, they are moody, or they're going through that change, just leave them alone for a couple years. And it really does not have to be that way for patients. We know that decreasing in sleep and how the estrogen, those fluctuations, those up and downs really can cause a lot of stress for patients. And it's usually in a time period where there is a lot of potentially new stressors in life too. Maybe kids are going off to college, maybe there's a transition at the household, changes in relationships. All of those things can sometimes collaborate around this physical change that's happening too. But sometimes that fluctuation can be helped if we think of it in a menopause state of, hey, these are things that your body these are changes that are happening for your body. How can we help those changes to be a lot more smoother for you so you don't have the huge peaks and valleys that come along with your mood too?
The other thing a lot of folks say as well is that menopause causes weight gain. Is menopause truly the blame for weight gain or difficulty of losing weight?
So we do know that as people get older, they tend to gain more weight, but a lot of that can be supplemented with other factors. Unfortunately, we can't pinpoint it directly to menopause because menopause has so many things that it impacts. Like I said, that head to toe kind of effect of our bodies and how those hormonal shifts happen. But we do know that, with increasing activity level and kind of working on lifestyle habits, going back to the basics, focusing on how our eating habits, alcohol consumption, drug use, smoking, being physically active, all of those things can affect the change that we do know is associated with menopause. And that's really the distribution of how our weight. So a lot of people will talk about that muffin top or that midsection under the arms that happens as we get older. And that happens because we're losing our lean body mass. And that's the muscle part that kind of keeps our figure, keeps our shape the way we're used to looking at it. So as that shape changes, our clothes fit differently. And we feel like, wow, the scale is just not what it used to be. And so we talk a lot about just kind of thinking about full body aspect of weight gain and helping. And I do encourage, there's some wonderful new medicines that are out on the market that can also help with kind of thinking about how weight is distributed, and not a sponsor or anything like that for those medications, but definitely a point of conversation to have with primary physicians, also your OBGYN.
I keep telling my wife I'm going through menopause because I got heavier. So, but let me ask this too, because this is a huge topic with couples.
Mm-hmm.
Desire for sex, is it decreased or and experiencing if a sex drive is decreased, is it considered normal?
So the wonderful thing about women is that the sex drive comes from so many different factors. We think so much about how mentality is doing. And if we don't feel good, if we're stressed or we're going through transitions of jobs and stress and life and kids and all of those kind of factors, it's not something that's always at the forefront of our mind as far as how our libido is compared to when you have different stressors, maybe when you're younger or when you're starting out in adulthood and you're kind of exploring life and everything like that. That is more of a topic that's more at the forefront of one's brain and how they're thinking. But libido can also become an issue because of pain. Intercourse can stop being as enjoyable for lots of various reasons, vaginal dryness, thinking about prolapse or things that are happening vaginally, or just doesn't feel as good. If it doesn't feel good, people aren't going to desire it as much. So anytime I talk to my patients about, okay, your libido is decreasing, let's talk about all these factors that come into libido and how can we make sure that we're addressing the right one that's most impactful for you.
I hear just about every woman in my life, my mother, my sisters, my wife, not my daughters yet, but every one of them that when they say they were going through menopause, they would say that they were going through a period of hot flashes. What are hot flashes and how long will a young woman have it or experience it?
So it varies from person to person. Some people have one hot flash and that's all they ever have. Some people don't really have hot flashes as they transition through this phase of life. And some people are miserable. It really is debilitating for their lives. They, are just in front of the fan. They just really can't even get away from, just standing there almost in their birthday suits to try to get rid of the hot flashes. But hot flashes is basically a sudden kind of flushed reaction that happens where it's almost about the shoulders up, where our bodies are sensing a change in temperature. And it's really telling our body to sweat or to cool that temperature down because it's becoming too hot. So it's a natural occurrence that our body is trying to do with the changes of the hormones in the body. And when that hot feeling comes, then the cooling effect happens after that. And so some people will maybe only feel the cooling part, those night sweats, or feeling like they just get a cold chill afterwards after maybe sweating a little bit. And it can happen multiple times throughout the day. We do know that there's definitely different triggers that make hot flashes happen more often. So people will find if they have drank several glasses of alcohol at nighttime, they're going to have more hot flashes or night sweats through the nighttime just because of that chemical response that's causing that. But hot flashes are really just kind of that feeling of flushness, the kind of rapid heartbeat feeling that happens sometimes for menopause transitions.
And if I can, I'd like to double up on something. We've talked about all the issues and the symptoms related to menopause, but let's talk about some solutions. How can women manage symptoms of menopause as well as including a discussion on what is hormone therapy and how can a woman now know if it's right for her?
That is a very broad question, and I appreciate the broad question because I am so encouraged that there are finally some conversations about solutions and help for patients. I know like I said before, for my mom and generations before me, it wasn't always something that was addressed. It was, hey, just deal with this. This is how it is now, and this is how it's going to be. And I'm so thankful every time my patients come and say, hey, does it have to be this way? Can I make it any better? Or what can we do to make it better? And things that you mentioned are things like hormones, but also non-hormonal options too. For instance, just thinking about stress reduction techniques, going back to those basics of, hey, let's work on stress. Let's maybe consider adding counseling to our routine of life to work through some of those stressors, those relationship changes, the difficulties with children getting older, working on finding how to be more active. Maybe it's a time in life where we can pick up a new exercise routine, or maybe just going for a 20-minute walk after each meal has been shown to be very protective for the heart and also help with the menopause types changes. And then you mentioned the hormone options. There are hormone options and there's off-label treatment options as far as medications or more taking daily or treatment medications. Some of those hormones we mentioned as far as replacement of estrogen, using medications that help smooth out that transition. So instead of it, going like this and it go ups and downs every day, feeling like we're in a roller coaster. Let's make that a little bit smoother ride going into the menopause phase, using some either low dose estrogen. There's lots of different ways that that's administered for patients. We really try to find the best fit for each patient. We do have to be careful with some of making sure that a patient is a good candidate for that medicine, because unfortunately there are some limitations in making sure that we're not causing harm when we're trying to be making things better for patients. So that's why there's these non-hormonal off-label, but they are shown to be beneficial and effective for helping lots of different symptoms. So it's a really tailored approach. It's lowest dose for the least amount of time to make it a better, smoother transition and to make patients' lives better.
Well, Dr. Kirby, I want to thank you so very much, man. This was very, very enlightening to me. I just didn't take into consideration all the little caveats associated with that transition that, you know, my wife went through, my mother went through, and some of my sisters. So it was very, very informative from my perspective. But what I like to do always when I have a guest that is as thorough as you are, I just want to make sure that we get everything out there that you want out there. And so at this time, I would like to ask, is there anything based on our discussion that you see a need to express additional information for purposes of making sure that the viewers are getting out of this discussion what you want them to get?
Well, thank you so much. And thank you all for viewing to this far. It's been a pleasure to present this information. And it's something that I'm passionate about, patients knowing that there are things that we can help with and there's things that we can make better for you. I encourage you to continue to see a gynecologist, or at least ask your family medicine provider, your primary care physician, if these are conversations that they are comfortable having, if they have experience with them. And if not, wonderful to go ahead and get a referral to a gynecologist, making sure that you're having those at least every other year, if not every year, pelvic exams, even when we're no longer needing pap smears or thinking about anything pregnancy related. Gynecologists do so much in helping our pelvic areas make sure we stay safe and make things comfortable in the future.